Your prostate has one biological job. It produces the fluid that keeps sperm alive long enough to reach an egg. That is the only thing this walnut-sized gland is designed to do. So why does it create so many problems after you turn 50? You start dealing with a weak urine stream, multiple trips to the bathroom every night, discomfort, and constant urgency. Something incredibly simple becomes surprisingly complicated. The reason is hormones. Your prostate never stops responding to them, even decades after you are done having children. This gland keeps reacting to testosterone and estrogen throughout your entire life. It grows larger, becomes inflamed, and responds to everything you eat or absorb from your environment. I am Dr. Max, and I have been practicing urology for 15 years. During that time, I have watched hundreds of men try supplements that completely miss what is actually causing their symptoms. Saw Palmetto, beta-sitosterol, and pygeum are the most common ones. The supplement industry built an $800 million annual business around these products. Then something changed. The largest research review ever conducted on saw Palmetto was published, and the findings were impossible to ignore. Let me show you what the researchers discovered. The Cochrane Review brought together every major saw Palmetto study from the past 2 decades. Researchers analyzed data from thousands of men who had been taking it for enlarged prostates. They measured everything that matters: prostate size, urine flow rates, nighttime bathroom frequency, and overall quality of life. The conclusion was definitive. Saw Palmetto produced no improvement in any of these categories. Men taking it had identical outcomes to men taking sugar pills. This matters because millions of men currently take saw Palmetto believing it helps them. Meanwhile, their symptoms continue worsening. They waste months or years waiting for relief that never arrives. The fundamental problem is mechanism. Saw Palmetto only attempts to block one enzyme pathway, and it barely affects even that single target. What your prostate actually needs is simultaneous intervention on 3 separate fronts: hormone conversion, inflammation reduction, and improved blood flow. I am going to show you 5 evidence-based approaches that do exactly this. We are counting down from good to exceptional. Number 5 is solid and well-researched. Number 1 is the breakthrough that changed how I treat patients. Let me start with number 5, tomatoes. Specifically, the lycopene compound concentrated inside them. This is one of the most studied nutrients for prostate health, and the research consistently shows positive results. Men who regularly eat cooked tomatoes have smaller prostates and fewer urinary symptoms compared to men who avoid them. One study from Italy followed men with benign prostate enlargement for 6 months. Half the group took daily lycopene supplements while the other half received placebo. The lycopene group showed measurable prostate size reduction, while the control group showed continued growth. Here is the key detail that most men miss. Cooking tomatoes matters significantly. Heat breaks down the thick cell walls and releases lycopene in a form your body can actually absorb. Tomato sauce works. Tomato paste works. Even ketchup provides more usable lycopene than raw tomatoes ever could. But lycopene only addresses inflammation. Number 4 targets the hormone pathway that actually drives prostate growth. Number 4 is pumpkin seeds. Specifically, the zinc and phytosterol compounds concentrated inside them. These target the hormone conversion that drives prostate enlargement. Here is what happens. Your body converts testosterone into a more potent form called dihydrotestosterone. This happens through an enzyme called 5-alpha reductase. Dihydrotestosterone binds to prostate cells and signals them to grow. More dihydrotestosterone means faster prostate growth. Pumpkin seeds contain compounds that naturally inhibit this enzyme. A study from Hungary tracked men with benign prostate enlargement who ate 2 tablespoons of pumpkin seeds daily. After 6 months, they showed reduced nighttime urination and improved flow rates compared to the control group. The zinc content matters too. Most men over 50 are zinc deficient, which allows that conversion enzyme to work unchecked. Pumpkin seeds provide both the mineral and the plant compounds that slow prostate growth. But pumpkin seeds work slowly. Number 3 works while you sleep, and men notice results within the first 2 weeks. Number 3 is green tea. Specifically, a powerful antioxidant compound called epigallocatechin gallate that concentrates in quality green tea leaves. This one targets inflammation differently than anything we have discussed so far. Here is why timing matters with green tea. When you drink it 2 hours before bed, these antioxidant compounds reduce inflammation in prostate tissue overnight while you sleep. A Japanese study followed men with mild to moderate prostate symptoms for 12 weeks. The group drinking 3 cups of green tea daily showed 40% reduction in nighttime bathroom trips compared to the control group. The mechanism is straightforward. These plant compounds inhibit inflammatory enzymes inside prostate tissue. Less inflammation means less pressure on your urethra. Less pressure means better urine flow and fewer urgency signals waking you up at night. Most men notice improved sleep quality within 2 weeks simply because they wake up less frequently. Green tea helps with inflammation, and that matters. But inflammation is only part of the story. Number 2 addresses what is actually driving that inflammation in the first place. Number 2 is omega-3 fatty acids. These are the compounds found in fatty fish like salmon, mackerel, and sardines. Here is why they matter for your prostate. They do not just reduce inflammation. They actually prevent your body from producing the inflammatory compounds in the first place. Your body creates inflammation through a specific biochemical pathway. Certain enzymes convert fat molecules into inflammatory signals. Omega-3 fatty acids block those enzymes at the source. A Norwegian study followed 300 men with chronic prostate inflammation for 16 weeks. The group taking daily fish oil supplements showed 58% reduction in pain scores and 62% improvement in urinary symptoms. Most men notice changes within 4 to 6 weeks. Better flow, less urgency, fewer nighttime interruptions. The inflammation quiets down because you are addressing what creates it. But omega-3 works even better when combined with one specific plant compound. Number 1 contains both. That combination is what makes the difference. Number 1 is flax seeds. Ground flax seeds containing a plant lignin called secoisolariciresinol diglucoside. This compound works with the omega-3 fatty acids I mentioned. That combination is what delivers results. The Zhang study followed 300 men with enlarged prostates for 12 weeks. Half received standard care. The other half consumed ground flax daily with 300 milligrams of this lignin. The flax group showed a 7.3 reduction in symptom scores. 10 men went from moderate or severe symptoms to mild within those 12 weeks. Flax seeds work through 3 mechanisms simultaneously. The lignin blocks testosterone conversion. The omega-3 reduces inflammation at its source. The fiber binds excess estrogen and removes it through digestion. No other food addresses all 3 pathways at once. Most men see improvement within 4 weeks. But here is what determines whether this works or fails. The protocol is simple but specific. 2 tablespoons of ground flax seeds every morning with breakfast. Not whole seeds, ground seeds. This matters because your digestive system cannot break through the hard outer shell of whole flax. They pass straight through your system completely undigested, giving you 0 benefit. Mix the ground flax into whatever you already eat. Yogurt works. Oatmeal works. Protein shakes, smoothies, even just stirred into water if that is easier. The key is consistency and timing. Morning consumption with food improves absorption significantly. Here is the timeline most men experience. Within 4 weeks, you notice easier urination and better flow. By week 8, the nighttime bathroom trips decrease noticeably. At 12 weeks, your symptom scores drop to the levels we see in the research studies. Now here are 3 mistakes that sabotage results for most men. First mistake is buying pre-ground flax and storing it for months. Once ground, flax oxidizes rapidly and loses its active compounds within weeks. Either grind it fresh weekly using a coffee grinder or buy small amounts you will use quickly. Second mistake is inconsistent dosing. If you miss 3 or 4 days per week, you never reach therapeutic blood levels of the active lignans. Third mistake is expecting instant relief. This protocol works through gradual changes in hormone metabolism and inflammation reduction, not immediate symptom suppression. One more thing before you start this protocol. This protocol works best for mild to moderate prostate enlargement. But you need to see a doctor immediately if you notice blood in your urine, severe pain that does not respond to over-the-counter medication, or complete inability to urinate. Those are red flags requiring urgent medical evaluation. Flax seeds are not a replacement for medical care. Some men need prescription medication or surgical intervention, and that is perfectly fine. This food protocol works alongside medical treatment, not instead of it. Think of flax as part of your foundation, not your only solution. Now here is what this means for you moving forward. You now have something most men searching for prostate solutions will never find: evidence instead of marketing. A protocol that actually works instead of supplements that do nothing. The research is clear. The timeline is realistic. The approach is straightforward. If this helped you, hit the like button so more men can find real solutions instead of wasting money on Palmetto. Subscribe for more evidence-based protocols. I cover testosterone optimization, erectile function, and urological health with the same approach. Real research. No nonsense. Talk to your doctor before starting any new protocol.